Good day. We are Group 2B of BSN 3E, and we will be presenting our research paper titled Level of Resilience and Adaptation of Nurses in the Face of Understaffing Challenges.
What is resilience? Resilience is the ability to bounce back or to recover from difficult situations. Next, adaptation is one's willingness to change to better suit their situation. Regardless of the additional workload and long hours, nurses still find it, despite their exhaustion, the ability to maintain resiliency and adapt. No matter the circumstances, the long hours, or the added workload, nurses find a way to evolve and to better suit the needs of their patients. For the purpose of the study, we aim to investigate the resilience and adaptation among nurses in the face of recurring stress as a result of understaffing in the hospital setting.
This study employed a descriptive quantitative correlational approach aimed to describe the relationship between the level of resilience and adaptation of nurses towards understaffing challenges by evaluating the variables impertinent to the study. The researchers didn't need to conduct a sample size because they included all nurses who met the criteria of having at least 1 year of experience, totaling 50 nurses from one of the government hospitals in Negros Occidental. Instruments utilized in this study include the Connor-Davidson Resilience Scale and ADAPTATION. Validity was confirmed by 3 experts with an average score of 4.9. Reliability measures showed convex alpha scores of 0.8 and 0.7. The instruments consist of 2 parts, a profile section and the questionnaire itself.
Moving on to the results and discussion, the demographic profiles of the nurses were grouped according to age, sex, department, and length of service, as shown in Table 1. For age, 28% of the participants were aged between 21 to 29, 56% were aged 30 to 44, and 16% were aged between 45 to 59. For sex, 82% of the nurses were female, which makes up for the majority of the sample size. For the department, 12% of the participants were found in the DR, 22% in the ER, which accounts for the highest number of participants in a group. 8% were in OB ward, 4% were in OPD, 10% were in OR, 6% were in the pediatric ward, 20% were in the male ward, and lastly, 18% were in the female ward. For the length of service, 22% of the participants had 1 to 3 years of service, 36% had 4 to 6 years of experience, 16% had 7 to 9 years of experience, and 26% had 10 or more years of experience.
Table 2 illustrates the level of resilience of nurses, which when grouped according to age, sex, and length of service, showed consistent intermediate levels of resilience. While for the department, the results showed that the nurses from OPD, with a median score of 31.50, were the most resilient, whereas the nurses from OR, with a median of 26, were the least resilient. The overall median for every variable in total is 30, which according to the author of the CD risk scale, means that there is an intermediate level of resilience across groups. For the level of adaptation, as shown in Table 3, nurses grouped according to age, sex, and department showed consistent intermediate levels of adaptation. While for the length of service, the results showed that the least adaptable nurses have an experience of 10 years and above, with a median of 26. The overall median for every variable in total is 24, which means that there is also an intermediate level of adaptation across groups. In Table 4 is the difference in the level of resilience, with a p-value of 0.05 indicating that the data was not normally distributed. The Kruskal-Wallis and Mann-Whitney scales were utilized to find that there is only a significant difference in the level of resilience of nurses when grouped according to age, with a median of 0.035. And there was no significant difference when grouped according to the other 3 variables. Moving on to Table 5, similar tests were used to find the level of adaptation of nurses, and the results show that there is no significant difference in the level of adaptation when the nurses were grouped according to the 4 variables. Lastly, for Table 6, illustrating the difference between the level of resilience and the level of adaptation of nurses using the Spearman rank correlation, The results show that there is no significant relationship between the level of resilience and level of adaptation of nurses when faced with understaffing challenges.
For the conclusion, the majority population of each of the demographic profiles were found to be nurses aged between 30 to 44 years old, female, has worked for 4 to 6 years and mostly working in the emergency room. All nurses were grouped according to age, sex, and length of service, show consistent intermediate levels of resilience. As per the department, the nurses who work in OPD were found to be the most resilient, while those who work in OR shows to be the least resilient. For adaptation, all nurses grouped according to age, sex, and department were found to have consistent intermediate levels, whereas the nurses with a length of service of 10 or more years were found to have the least adaptability. There is a significant difference in the level of resilience of nurses when grouped according to age. However, there is no significant difference in the level of resilience when grouped according to the other variables. As for adaptability, there is no significant difference in the level of adaptation when grouped according to each variable. Finally, it was found that there is no significant relationship between the level of resilience and level of adaptation of nurses in the face of understaffing challenges. For the recommendation, the study suggests tailored interventions to support nurses based on demographic variables, emphasizing continuous professional development, stress reduction strategies, and work-life balance initiative. It underscores the importance of resilience-building techniques in nursing education and healthcare settings to mitigate the negative effects of work-related stress and enhance patient care quality.
Thank you for listening, and please see the attached QR code for the references. This has been Bicentenary E2B. God bless.